Welcome to imPACT 2020, a conference on technology and public health perspectives on private automated contact tracing. My name is Danny Weitzner. I'm director of the MIT Internet Policy Research Initiative and co-PI of the PACT project. We appreciate all of you taking time to join us. We're all here to understand how to shape the extraordinarily powerful technical tools at our disposal in service of public health goals with strong privacy protections. From the perspective of the PACT project, it's clear that whatever is done with smartphone technology should be a complement to the core public health and manual contact tracing strategies now being implemented. Before we start, I want to thank our partners who came together just 3 weeks ago to form the PACT project from Boston University, Brown University, Carnegie Mellon, Massachusetts General Hospital Center for Global Health, SRI, and the Weizmann Institute for Science. From MIT, we've had extraordinary partnership from Lincoln Laboratory and the Media Lab. I want to offer special thanks to our program committee, Dr. Louise Ivers, Emily Shen, and John Wilkerson. We have an extraordinary leadership team from our Lincoln colleagues, Mark Zisman and Israel Soibelman, and the team from IPRI, Taylor Reynolds, Mel Robinson, and Katie Fairclough have put this event together with extraordinary alacrity. Just a word about logistics. You can find the agenda link from pact.mit.edu. We'll be taking short breaks, 5-minute breaks, as you see, between sessions. We will, during the Layer 1 and Layer 2 panels, be taking questions from the audience. We're asking that you use the form below the video window to submit questions to our moderators during their panels. Please wait until the panels actually start and you get a signal from the moderator to offer your questions, and we'll be selecting as many as we're able to present to the panelists. I want to remind everyone that today's event is open to the public, so for those of you who are speaking, you should be aware that there may be members of the press in attendance and that they may be taking notes or filming. With that, I'm really delighted to open our conference with remarks from the Commonwealth of Massachusetts Governor Charlie Baker. The governor recorded his remarks earlier, and I'm not going to give away his punchline, but you won't be surprised by his sense of urgency about the need for contact tracing as a key part of the state's response to this public health crisis. Governor Baker's announcement about contact tracing on April 3rd was among the most impassioned and ambitious of all of the closely watched daily briefings he's held since he began these in early March. Governor was the first in the nation to embrace an ambitious manual contact tracing plan, and I know that many states and federal agencies are watching eagerly to learn from this effort. The Commonwealth is indeed fortunate to be led by someone who understands how innovative ideas can be combined with tried and true methods in a manner that preserves fundamental privacy values and public trust. Now we will hear from Governor Charlie Baker.
Good morning, everybody. This is Massachusetts Governor Charlie Baker, and I'm sorry I can't join you live via whatever particular conferencing mode you're using here to kick off your conference. But I did want to take a minute to do 3 things. First of all, to thank President Reif and MIT for hosting this virtual event today. This issue about contact tracing, particularly on times like this with a pandemic like the one we're all dealing with, is not just an issue for Massachusetts. It's not just an issue for the country. It's frankly an issue for the world. And I'm glad to have an organization like MIT teeing up a collection of leaders in the technology and public health community to engage in a discussion about how to ensure that we do the absolute best we can to get this right. Secondly, I just want to say how important we believe contact tracing is going to be to our efforts, not just to chase the virus, which it will be, but to give people confidence and comfort over time that we can, in fact, safely go back to work and sort of return to something that will look like what I'm starting to call the new normal. And third, to make absolutely clear to all of you that we understand and respect the importance of privacy in this, and I'm glad that that's a fundamental part of this discussion. The folks on our team who are part of this event you're having today are working this issue hard on our end, but we are working on a presumption that for this to truly be successful, all of it, the technology, the platform, the outreach, the isolation, the quarantine, the support, all of it to work, it's going to have to be a tried and true combination of technological capability, respect for privacy, and sort of what I would call the process boots on the ground that are necessary to make sure that the connections happen, that the engagement takes place, and that the advice and guidance that's so important to making sure that contact tracing works and the support that people need to get through this will be in place. But this isn't just going to be a Massachusetts issue. It's going to be a U.S. issue. It's going to be a North America issue. It's going to be a global issue. And frankly, the smarter we get about this, the better we are at it, the more likely we are in a global economy and a smaller world to be able to deal with whatever people throw at us with respect to this type of virus. This is obviously an unprecedented time. There's not a playbook here with respect to how to manage this particular outbreak. But what I can tell you is part of what excited us in Massachusetts about working with Partners in Health to create our own approach to how to take down and run at the virus by using contact tracing was based on the fact that this wasn't a theoretical model. The folks at Partners in Health have been doing this for years to stomp out outbreaks and infectious disease in places all over the world. And when we talked to them, it became very clear to us that if we were willing to help them make the investments that they need to make to amp this game up in a big way, we could do something really important to provide comfort, security, and a sense of confidence to people here in Massachusetts that we weren't just running away from the virus, but we were actually trying to come up with strategies to actually fight back against it. And I certainly believe that not just here in Massachusetts, but in a lot of places around the world, this type of technology, this kind of a platform, this sort of operating model, and certain rules of engagement are going to be how we all beat back pandemics, not just this one, but any we may see in the future. So this work you're doing today is incredibly important. We're glad to have people there who can benefit from the shared knowledge that will be brought forth during these conversations. And I just want you to know, as the Governor of the Commonwealth of Massachusetts, I happen to think this is one of the most important initiatives we'll be pursuing in our efforts to keep people safe and provide them with confidence that we can get past this and on to whatever the next new normal looks like. Good luck and God bless.
So I think I'm on now. Hello, my name is Ron Rivest, and I'm the PI of this project, based at MIT, but incorporating many partners. I think Danny's opening remarks and the governor's opening remarks really set the stage beautifully for what will be a wonderful conference today. I'd like to share my screen and talk a little bit about what will be happening. So let me get that up. There we go. So we have title slide. So this is the PACT organization, and this is the conference imPACT 2020. My name is Ron Rivest again. I'm a faculty member at MIT. And we're going to talk about contact tracing today. We have many partners, as Danny said. It's been a wonderful to see how the collaboration has grown and extended between many people. This is a task for humanity to fight back this virus, and we're all chipping in. It's just wonderful to see that happen. So first of all, welcome to everyone who's out there participating, listening in. We appreciate your attention to this issue. We appreciate your contributions, your support, and your thoughts as to how we might best proceed to fight back this virus together. The conference is called imPACT 2020. We often get asked, what does imPACT mean? If PACT stands for Private Automated Contact Tracing, which it does, what does imPACT stand for? And the answer is we really don't have an answer for that. It just is a great word containing PACT in it. It could stand for Innovation in Massachusetts, but it's really, as the governor said, something broader than that. So imPACT 2020, we're looking, the real goal here is to have some impact in the year 2020 to help fight back the virus. So take that as the definition of what the conference is about. So welcome, and let's talk a little bit about what this conference will be about then. So what are the goals here? The top level goal is how can we best collaborate to devise and implement tools that will help defeat the novel coronavirus. And the word collaboration is key here. This is not an MIT effort. This is not a US effort or a Massachusetts effort. This is a worldwide effort to get get us all on the same side and work together to defeat the coronavirus. So collaboration is the key here. It's not about I'm right, you're wrong, or who gets credit for this or that. It's about doing something quickly and effectively and privately to defeat the coronavirus. And it's not only devising the ideas and getting the framework right, it's about implementing tools that are really going to be used in practice. And this should happen this year. So urgency is one of the key features of what's going on here. The conference is really short. We have 3 hours and just a few panels. So we're going to focus today on a few key questions about contact tracing because our time is limited. So we're not going to be talking about lots of things. Future conferences will address other aspects of contact tracing. If you come away from this conference with more questions than answers, that's probably appropriate, right? We're going to answer a few questions, but you'll probably be stimulated to think of more questions. And we appreciate hearing what your questions are. In the future, we'll have extensions to this conference that cover things like maybe what are Google and Apple really doing? We'll be learning about that as that evolves, how do decentralized versus centralized approaches compare and so on too. We probably won't get into that much today, and so on and so forth. So what should we be talking about in future conferences? We want to hear from you on that. There will be future conferences. For today, we're going to focus on 3 specific questions. The first question is, can automated contact tracing be a useful supplement to manual contact tracing in Massachusetts and elsewhere? And the key framing here is that automated contact tracing is a supplement to manual contact tracing. Manual contact tracing is the premier, the gold standard for how this should be done. And automated contact tracing is not a replacement for that, but a tool that manual contact tracers can use to increase the number of contacts that are found and followed. Second, how can smartphones use Bluetooth to tell if they're close enough for infectious coronavirus spread? So Bluetooth is the key proximity detection technology we'll be using. How well does that work? We'll have a panel on that. And finally, how can automated contact tracing be done in a privacy-preserving manner? So privacy is a key goal here. We don't want to build a panopticon that knows who everybody sat next to on the bus. We want to be able to figure out what's relevant for medical purposes and not only, no more. The agenda for today consists of 3 panels. The first one starts with the health organizations, public health requirements for contact tracing, and that will be moderated by Louise Ivers, who I'll introduce in just a minute. Second, we'll have a break, and then we'll get into the foundations for proximity detection, which is how we would like to approach this problem. How does Bluetooth really work? How well does it work? And John Wilkinson will be moderating that panel. We'll have a break, and then a third panel on privacy and cryptographic protocols with Emily Shen as the moderator, talking about how to implement these things in a way that preserves privacy. As we saw earlier from the governor's remarks and from Danny's remarks, this is a key feature we want to have. Finally, we'll close with some summary and next steps and wrap it up by 2 o'clock. So that's the agenda for today. And since time is limited, let's get right into it. I'd like to introduce Dr. Louise Ivers, who's an infectious disease physician and the executive director of the Center for Global Health at the Massachusetts General Hospital. She's also an associate professor at the Harvard Medical School, and she will run the first panel. Louise?
Great, thank you very much for the introduction, and I'd like to invite my guests to turn on their videos and unmute themselves. Thanks for everyone watching for joining us, and as the governor emphasized, and as others have already said, and us on the panel as public health practitioners, we know that pandemic response has many components: extensive testing, care of people who are sick, social support to people who are isolated, many considerations. So we're going to focus today the discussion on the contact tracing, and I'm really delighted to introduce 2 guests. One is Luis Gutierrez. He's the executive director of the Massachusetts Health Connector. He's a longtime information technology and planning specialist in both private sector and state government. And for those of you who are joining us from outside our state, the Health Connector is Massachusetts' health insurance marketplace for health and dental coverage. And it's helped Massachusetts be amongst the highest in the nation for health insurance coverage. So welcome, Luis. And KJ Sung is a physician in the international non-governmental organization Partners in Health. He has spent his career leading efforts to care for patients with multi-drug resistant tuberculosis globally. He's innovated treatment approaches and policies to end the global epidemic of TB deaths. And right now, he is the Chief of Strategy and Policy for Partners in Health's Massachusetts COVID-19 response. So welcome to both of you. Thanks for joining us. Let's just dive right into it. Lewis, my first question to you. So Massachusetts announced this plan to scale up contact tracing, staffing, and systems. Can you tell us a bit about what those systems for COVID contact tracing look like right now in Massachusetts, and how you see those evolving in the coming 2 to 3 weeks as they scale up the manual contact tracing and initiatives?
Gladly, and it's great to join you all today. I will note that I don't speak on behalf of the Department of Public Health, but as the connector authority is supporting and coordinating to stand up the new contact tracing efforts, we know from a practitioner's view a number of things that are coming into place. The first thing I would just note before we talk about the new arrangements is just what the case is in Massachusetts. Some states will differ with regard to infectious disease contact tracing generally, and then we'll get into the new efforts. You know, contact tracing for infectious diseases, whether tuberculosis or certain STDs or whatever, is a long practice tradition that's known to work in stemming the spread of infectious diseases. And historically, we have a setup in Massachusetts where all of the labs that process test results in Massachusetts, in our major academic medical centers and hospitals, doctors' offices, for infectious disease outcomes, those results all flow in to our Massachusetts Department of Public Health. They receive those infectious disease lab test results in a central system of record for epidemiological statistics and case management. And they work very closely with 351 local boards of health in Massachusetts. The state lab receives these results. They go into a central system. We'll talk about that in a little while, and stores them in the central state system. Then from there, they go to local boards of health, which have both the proximity and the authority to pursue active case management. So ever since the pandemic broke out, you know, the local boards of health have certainly made it a huge priority for follow-up, but we're looking at numbers that simply outstrip the capabilities of most of the local boards of health to really follow up on effectively. And that's where the administration came about its plan to supplement those efforts with something new called the community tracing. It's a cooperative effort between the Commonwealth of Massachusetts and Partners in Health. And my colleague, Dr. Sung here from Partners in Health, has been a great partner. And Partners in Health will supply qualified contact tracing capacity at a time when many of the local boards are seeing more cases than they can effectively manage. It certainly involves staffing and will increasingly leverage automation technologies. The very basic element of it at the moment is that cases that are identified from lab tests are made available to local boards of health. And for those local boards of health that decide they need assistance handling a certain number of cases, those cases then flow into a call center setup that has been stood up in the last 2.5 weeks. It's a Salesforce CRM, well secured, but it's a Salesforce CRM where these cases flow into to be worked by staff from Partners in Health. We're looking at surge capacities towards 1,000 people ultimately doing contact tracing. I heard once from Dr. Kim of Partners in Health, the the notion that we sometimes set our sights too low with regard to our aspirations for public health. And with regard to this pandemic, we don't see it as being too late to intervene. We see it as being the only way through getting comfortable that we're able to come through the far side of this pandemic, is to really effectively do the contact tracing at scale. And with that having been said, I'd over to KJ for just early remarks about approach and any details you'd like to add, KJ.
Sure. I think that was actually quite comprehensive. The only thing that I would add is that, was something that Lewis was referring to, which is the Salesforce, which is the CRM. And so, from the very beginning, we realized that technology has to be included here. And, these are all people who are working from home. This is different from the type of contact tracing that PIH has done in other countries. So you really, if you listen to what Lewis is saying, you've got 1,000 people that are all have to work with each other, have to interact with a database, have to be able to input data and even just communicate with each other about what they're doing. And so technologically, this has been extremely complex. So this is actually one of Lewis's major roles, is to try to get something usable. So, this very ambitious project can actually function. And I think that, that aspect of technology, sometimes it's not maybe as sexy as some of the others, but it's absolutely, I would say that without that technology, this project just couldn't function at all. It couldn't function at all. It was really it was part of our plans from day one, and it's still a work in progress. So it's working. I just got off a training of over 200 people that today will take them through how to use this CRM. And we have partners who are working like crazy just to improve the data flow, the syncing in and out with the Department of Health databases, but also just make things and life easier for the contact tracers.
Thank you both. So if I'm understanding correctly, KJ, what you're saying is that even just the case management of the large numbers of people who've tested positive and then contact tracing them with the humans is already a data management piece of the work that needed investment and support. And can you maybe, KJ, take us through, because as we've said, contact tracing is like built into our understanding of public health, but for many people, this is a brand new idea. They think even maybe this is a new thing, contact tracing, but could you walk us through, KJ, like what your call center folks will be doing? So I've been diagnosed with COVID and I receive a call. Can you just help the audience understand briefly what that looks like?
Sure. So these are all people who, have already been tested. So a COVID patient has been tested and has already received the diagnosis. So has already gotten a call from the physician that ordered that test and explaining what that test means. Then this is where the contact tracing team steps in. So there's a first. So again, this is jargon. So again. Like Luis says, sometimes we slip into our own medical jargon. So, but I'll try to explain. So, they'll call a patient a case. So, we have the first call. They'll say the first call is the case investigation. So somebody calls that patient and says, "Okay, let's try to figure out everybody that you've come into contact with in the past. Since actually what we say is 48 hours." Before your symptoms started, because we know now that COVID actually, you can be infectious even before the symptoms start. So it's really an interview, and it's really, open up your phone. Let's see, look at your calendar. Sure, we want to know everybody in your house, but are there other relatives, that you might have visited that are not living at home? Maybe you had dinner with a friend. There's a lot less, this discussion is actually nowadays, because of the social distancing efforts, people aren't going out so much. So this is actually a good time to start contact tracing because it's easier. What we know from the Koreans, for instance, is that when you have people going to work and you release these stay-at-home orders, it actually gets much more complicated. And still possible, and certainly, this is, I think, one of the promises and potential benefits of the solutions that you're going to discuss later today, is that if you're really traveling widely and you're having talks with lots of people, no matter it's actually hard to remember who you actually for the past 7 days, 48 hours sometimes you can't even remember when you started having symptoms, and 48 hours before that, it actually is very, very difficult, and it's really only 15 minutes of time within 6 feet. That's the current Department of Public Health protocol. So that's the first call, which is called the case investigation. The second call, now that case investigation, you have a whole list of people now that this case has come into contact with. So then you just call those people. That's the second call. You tell them you've been exposed, and do you have symptoms or not? Obviously, if you have symptoms, you need to call your PCP. If they didn't know that they were a contact, then they might have said, well, I just have a cold. It's fine. I'm just gonna go to work. I'm just gonna work through this. It's not a big deal. So having this knowledge is really important to the contact. And the instructions really are very clear. You need to be in quarantine. You shouldn't go out. You need to minimize all of, because you might even be developing the disease, say in 3 or 4 days. Even if you're totally fine right now, there's really a risk that you could develop disease and that you could spread it to other people unwittingly. So people are generally really quite happy that they're getting these calls so far.
Great, thanks. So you've given us a little bit of a seed of an idea of when, in particular, this additional discovery piece of kind of using phones to help identify who else you've been in contact with could be useful. And I want to come back to the timing of that in a second, but maybe I can turn to Lewis and ask, the governor mentioned in his speech earlier, and this has been a kind of a principle of the PACT group, is that privacy is really important. And again, in public health, we know that that's part of our DNA, so to speak. Can you mention a little bit about the privacy commitments in this expanded contact tracing effort and what we've promised and what we need to be?
Absolutely, because we all should realize that the contact tracers that are coming on board with Partners in Health, this whole operation is bound under Department of Public Health confidentiality rules. And those rules flow down to all of our contractors and subcontractors. This is a health operation. And part of our trust in Partners in Health is certainly rooted in the fact that they're used to dealing with this kind of information. They know how it's done and can really work in the training and security training to make sure that the people being brought on are aware of their obligations and restrictions. This is a topic that occurs at multiple levels. The data itself, with regard to identifiable information, is protected. The security of the system that's being stood up has gone under multiple reviews by security architects in the Commonwealth. The contractual provisions flow down. There is nothing that's different with regard to state and federal laws regarding private information. And so we're essentially treating this as a scope expansion undertaken under the same rules that we would with the Department of Public Health or local boards of health. It's not a somehow standalone commercial endeavor. I think a central topic as we get deeper into automated contact tracing with proximity detection is will become the issue of, whether these capabilities are entirely voluntary or whether there are social discussions that need to be had regarding requirements to utilize, particularly as people come into the next period of emerging from social distancing. That's a really important topic, but it's not one that we're in any way prematurely entering into at this stage. This is all about protected health information.
Great, thanks. That's actually a really nice segue also into something I wanted to bring into the conversation. And maybe I'll pose this one to KJ. I know that health equity is a really important piece for the three of us in our day jobs or our pre-epidemic jobs. Obviously, not everyone owns a phone. Some people don't have Bluetooth-enabled phones. There's elderly, there's groups of people that we have to be really mindful that technology doesn't just perpetuate inequities. We're already seeing how this pandemic in the US is really affecting certain groups more than others. What would you say to this group of technologists who are going to be following us in how they need to be mindful of that, or how they should be thinking about existing health inequities and trying to make sure that we're not just reinforcing them?
Well, that's an important issue for all of us on this in this conference. But certainly, if you think about it, it's actually the same. The contact tracers that, for example, I was just training now, they have to deal with the same thing, right? A lot of people don't have a phone. The model that we're using is actually highly technological, and it does require somebody to have a phone. And we know that there are people, like you were saying, who may not have access, or maybe are for various reasons, even if they do have phones, are very difficult to get in touch with. So let me tell you how we're dealing with that. This is what Lewis was talking about, was that we really view ourselves as an extension of the Department of Public Health. So in fact, what we often tell the local boards of health is that we're just doing the 90% of the easy cases. Okay, these are the ones who people you can call and you can talk to them, and maybe they speak a language that we can actually that we can actually communicate with them with. But there's a whole, if you talk to the local boards of health, there are so many types of people that are in need of, that are getting diagnosed and then that need contact tracing. And, the solution that we're offering, yes, maybe, for 90% of the people, this is a great solution. But for that 10%, and you can just, the list is endless. There are nursing homes, there are homeless people, there are people with really difficult chronic psychiatric illness, who is even hard for their families to get in contact with. And so the local boards of health, they're really like the boots on the ground. They can actually go and go physically visit people. And in some sense, what they're saying is, we want you to just do, and they're really talking about this CTC. We want you to deal with the 90% of the easy ones, so we can have the time to deal with the 10% of the really, really tough ones. And I think, Louise, you and I know that 10% might be smaller in number, but actually might take more time and effort than the 90%. So absolutely, this is what Louis is saying, that this is a partnership. So I would guess, just to extrapolate, we just all have to work together, right? There's boots on the ground, there's the local boards of health. Right now, we are bringing in actually the partnerships with the community health centers. Again, they're kind of similar to the local boards of health, but they have a different perspective. They have the medical perspective. They are dealing with these really, with homeless populations and underserved populations and languages that, really rare. They go into these communities and they have really good relationships. So we need to have that sort of really human element. We have kind of a moderate technology-based solution for a lot of patients. And then I think that this, the promise of what we're talking about here is is, to even deal with more types of people. And I think it's just, you really have to have good integration of all of these methods and really good communication so we can reach the greatest number of people.
Yeah, so to be clear, contact tracing on its own is not a panacea, and certainly technology that supports contact tracing is not going to be the magic bullet. And we know that pandemics need comprehensive integrated approaches with an eye to equity. And so this is potentially one piece of a puzzle. Lewis, I'll turn back to you. We have a couple of minutes left in this session. If you were, because you are, in front of a group of large numbers of engineers and gurus of privacy and technology, like what would you set the charge to them? What kind of a smart, precise system around proximity would actually be helpful in your job? And then I'll ask KJ the same question before we close out. What do you want these folks to come up with?
I'm going to address at a very broad level because honestly, I think you all will be smarter at the detailed kind of layout of requirements specifications, but just from experience implementing large systems endeavors at the state, the thing that I'm worried about is that there becomes a splintering of approaches. I have a strong sense that there's a there as you all are looking at privacy protected proximity tracing using Bluetooth or near field communications methods. I have a strong sense there's a there. I'm very worried that a general set of utilities could then be adopted by a multitude of different approaches that don't all really kind of have standardization to make them work together. Because at the end of the day, we kind of need an approach to the proximity tracing that can be pretty uniformly rolled out across a particular population base. And particularly if the adoption is voluntary, we need it to be very, very straightforward. If I'm thinking of KJ's kind of 90-10 rule, I would kind of flip that with regard to use of technology. There's kind of a 20-80 rule where 20%, I would say, are sophisticated and loading the app, making the settings, doing what needs to be done, and another 80% that are going to need something very straightforward. And the other general aspect of design is that we can't deal with solutions that are how would I say, monolithic. Like, in order for this to work, you have to make us the center of your universe. We're really successful at plugging in automation components. Like right now, we're working on automation that could help on 14-day automated follow-up that plugs right into the CRM capacities and the personal capacities of the tracing effort. But it's a problem when we look at other proposed solutions that essentially require us to swap out everything and start on a new platform. So a lot of modularity, a lot of ease of use and standardization where possible. And also, we will all need to understand privacy implications and how we deal with when the proximities are such that you can actually identify who is on the other end of a Bluetooth chirp. Those are the kinds of issues we're really going to need to understand and work through.
That's really great. Actually, I'm watching the time and our panel is out of time. This was a really great discussion. Thank you both very much for joining us. There's so much more about the public health integration piece that we need to talk about. I think that'll be for future sessions, but thanks for joining us. I know that we're going to take a 5-minute break. So if all of our audience would like to go and stretch and get some coffee or whatever, we'll be back at 11:45. Thanks, Lewis and KJ.
Thank you.
Welcome back, everyone. We're about to start our next panel discussion. I'll let everyone know that we have right now over 900 active views going. So we appreciate everyone who's been joining. I want to introduce John Wilkinson, who's the leader of the Cyber Systems Assessment Group at the MIT Lincoln Laboratory, and he's the chief engineer of the PACT Engineering Working Group. So John, take it away for your panel.
All right, thank you, Danny, and thank you to all the folks who preceded us with all that good information that's going to set the stage for our discussion of Bluetooth sensor engineering. So let me see if I can share that slideshow right here. So hopefully you can all see this. I'm really pleased to be able to share this virtual stage with our distinguished panel members this morning, each of whom I will introduce prior to them making their opening remarks. I'm going to start with just a few remarks to say why we're here and what we intend to discuss during this particular panel. So if I can advance the slide, there we are. All right, so those of you with an electrical engineering or public health background are probably quite familiar with receiver operating characteristic curves, but some of you may not be. And so let me just do a quick explanation of that. On the horizontal axis here, we have the number of false positives. Those are the people that we inconvenience and worry and expend medical effort on incorrectly, asking them to self-isolate or get tested when in fact they're not infected. On the vertical axis, we have the number of true detections. Those are the people who actually are infected or are about to become infected. And on those people, we're spending our efforts wisely. So there are a few different places in this box where you could be. You could be at the lower left corner of the box, which is the easy one. That's do nothing, right? We're not inconveniencing anybody, but we're also not protecting anybody. The other one where you might think we want to be, but it's actually not the best place to be, is in the upper right corner of this box, and that's where we are now. Okay, under stay-at-home orders, we are getting 100% of infected people to self-isolate and stay at home. Unfortunately, that's only because we have 100% of all people self-isolating and staying home. So the best place to be in this box is actually in the upper left corner, where we only ask the people who need to stay at home, and we don't inconvenience or worry anybody else unnecessarily. So what is the best approach we have to getting from that red star where we are now to the green star where we would like to be? Well, currently that is manual contact tracing that was discussed earlier. That is a system that is proven in its effectiveness, and it's really our best hope at this point. Our concern, as KJ aptly said earlier, is that his folks are very skilled and they're pretty busy. And he would like us to handle 90% of the cases that are easy so that he can focus on the hard 10% of cases. So our only concern with manual contact tracing is that it might not scale. And we would like to offer automated contact tracing in a privacy preserving way to supplement and augment that manual tracing. Now, initially, our automated system may not perform all that well compared to manual tracing. We might detect fewer truly infected people, and we might inconvenience and worry quite a few more non-infected people. And if we wanted, we could crank the sensitivity of our detectors, more on detectors in a minute, up very high, and we could approximate the situation that we're in now, where you're within Bluetooth proximity of everyone at all times, and we just advise everyone to stay home. That's clearly not helpful. But hopefully, through a spirit of international cooperation and open data sets and agreed upon metrics, we can improve the performance of an automated contact tracing system until it becomes a truly valuable supplement to manual tracing, getting us closer to that ideal performance in the upper left corner. So what is this panel about? This panel is now about building those detectors that I mentioned, or informing the building of the detectors through research and experimentation. What we're really trying to do is trying to determine when someone has been too close to an infected person for too long. It's the too close for too long problem. And that could be that you are very close to someone for a very short period of time, for example, hugging them, or worse yet, if someone sneezes on you. Or it could be that you are rather more distant from someone, 10 or 15 meters away, at the opposite end of an airline cabin on a transcontinental flight, where you're together for 8 hours breathing the same air with everyone else in that cabin. Both of these might be too close for too long, and they might necessitate an alert in the upper left corner of this box. On the other hand, maybe just being on the subway with somebody for 10 minutes in the same car does not constitute an alert, and that's in the lower right corner. Now, we're going to rely heavily on the experts, the virologists, the epidemiologists, and the public health specialists to break out their sharpest number 2 pencil and draw the finest curve that they can across this plot. And then we as engineers are going to look and scratch our heads and say, well, shoot, that horizontal axis down there is range, and Bluetooth doesn't really give me range. It gives me signal strength. And so we're going to take their fine line and we're going to paint over it with a really broad brush. So this panel is all about improving the technologies to make this detector a little bit better and more closely approximate the fine line that the public health officials may give us. So with that, I would like to turn it over to Swarun Kumar, who is an assistant professor at Carnegie Mellon University and leader of the Emerging Wireless Technologies Lab at CMU. Swarun, thank you for being here today.
So, hi everyone. I'm Swarun Kumar from Carnegie Mellon. I'm an assistant professor at CMU. I'm a researcher who works broadly in wireless systems, Wi-Fi, cellular, you name it. One of the problems that has been particularly close to me, the problem of wireless location tracking, which has many parallels with the problem of proximity sensing that we care about for COVID-19 contact tracing. So if we switch slides, I want to talk about one of the important challenges that to set the problem up for some of the other panelists as well, which is why is this problem of proximity sensing particularly hard? Why haven't we solved it yet? Shouldn't we already have a solution? And this is particularly a difficult question to ask me as a wireless location tracking researcher, because hey, my PhD thesis about like 5 years ago was on wireless location tracking. So I wanted to show you a small clip of wireless location tracking that I worked while I did my PhD at MIT, this was a location tracking system where we were trying to find the exact distance, the proximity between 2 laptops. And the key challenge was to do it even when the laptop is behind the pillar, right? And the signals are absorbed by concrete, and be able to track the exact distance between 2 laptops. And so this goes back to the question, right? Hey, if this is a solved problem, what's so challenging about it, right? So I want to add a bit of the bad news and the catch here in the next transition, which is we use regular laptops and we use Wi-Fi on the laptops, but we do require special drivers. We were not just measuring the received signal strength as we are currently trying to do with Bluetooth. We are also measuring the phase of the signal, which gives you much more fine-grained location tracking information. And so this brings us back to the next slide, which is why Bluetooth, right? We're using Bluetooth as our favored approach across all the panelists because it's present in most smartphones. Bluetooth has, relatively speaking, compared to cellular and Wi-Fi at least, lower power consumption, although I think Joel will add more to talk about that. Bluetooth is also easy to set up phone-to-phone connection. So in Wi-Fi, you're typically talking from your phone to a Wi-Fi access point, whereas phone-to-phone gossip and beaconing is much more natural in Bluetooth. It's possible in Wi-Fi, though much more complicated to set up. And finally, I would say Bluetooth is maybe blockage-proof is not the right term, blockage-resilient. You can still get your Bluetooth signal even if your phone is in your pocket. Of course, it's going to be weakened, it's going to be attenuated, but you still get some signal. It's not completely dead if the device is within your pocket. Which is all of these are requirements for you to be able to perpetually do contact tracing. Then again, why are we measuring received signal strength? Why is this our useful metric? RSSI is the technical term for essentially received signal strength indicator, which is the power received by one phone related to another phone. So in this picture, if 2 phones are separated by some distance d, idealized models tell you, in free space at least, the received signal power is proportional to inversely proportional to the square of the distance, right? So it's a good metric to measure receive power and get an approximation of the distance, or is it, right? There are plenty of challenges that I want to talk about in the next slide. First, there are many sources of error, as you can imagine, right? This is not quite the story. So imagine first, like the human body, right? It can significantly absorb the received signal. So depending on whether your body or head or any part of your body is between the two phones, you could have significant absorption. Now, I've put an approximate number there, 15 dB, but it could be any number in that ballpark, depending on which part of your body and whether your body is there or not. It's not just the body, right? There's also all the other objects around you. So the so-called multipath effect, signals reflect off various surfaces around you and reach your phone. Now, this is in some ways a good thing because it is helping supplement the signal when it is absorbed by other surfaces, such as your body, but it's also a bad thing or a factor that can add some confusion because you now don't know whether you're measuring the direct distance between the two devices or this indirect distance that's through that reflected surface as well, right? There are other factors that also play a role. For example, the orientation of the mobile device. So let's say if the device is flipped or rotated at an angle, it can significantly change the amount of received power of that device. And that, again, can affect your received signal performance and measurements, right? So all in all, already we've added 15 dB, 10 dB, 5 dB. And finally, there's going to be some error because, hey, what if I have an iPhone versus an Android phone versus a different versions of an iPhone or an Android phone? That's also going to add confusion, right? So if you put all of these together, forget even the device-specific behavior. Just the first three entries adds up to 30 dB. That's like 3 orders of magnitude, right? In terms of received power, because dB is in log scale. So this could make a device that's very close, 2 meters, look like it's 20 meters away, right? And vice versa if you're assuming all these devices already exist, right? And this is a big challenge for any contact tracing application that we build on top. But I want to add in the next slide that it's not that all hope is lost, right? There are other sensors on your phone as well, right? So for example, the ambient light sensor could give you cues about, hey, is your phone in your pocket or in your purse? That could give you some indication if there are blockages. You also have devices, accelerometers and IMUs on your device to tell you, the Compass app knows how the device is oriented in one plane. Gyroscopes can give you orientations in other planes as well, magnetometers. And you can also measure this across different classes of devices and collect lots of measurements about how each device, say an iPhone versus an Android, different versions of Android phones, attenuate their signals. So this is probably a great cue for some of Jen's work because they have collected a lot of these measurements. So maybe I'll hand this back to John, who should then hand this back to Jen.
All right. Thank you very much, Swaroon. Now I'd like to introduce Jen Watson, leader of a large group at MIT that develops advanced signal processing algorithms for wireless and RF applications. Jennifer, thank you for being here.
Thanks, John, and thanks, Swaroon. That was a really great setup for what I want to talk about. So like Swaroon said, there's enormous variability in the RSSI received by a device. And so what we really wanted to do is try to get a handle on this very quickly in a very simple way. So a number of us have taken measurements actually at our homes. There's a photograph here of a very simple setup that anyone could run in their home, where we tried to get an estimate of the different, the variability of the signal as a function of phone orientation, location, multipath environment. If I do it in my home and a colleague does it in her home, and then we can compare results. Also looking at a rotation through all kinds of viewing angles to get a handle on the orientation differences and what that induces. So by collecting some measure of data, certainly not even close to enough, we tried to get a handle on, okay, Swaroon just told us there could be 30 plus dB of variability. Do we really see it? And it turns out we actually do. And so you can see on the plot on the right, we're plotting the variability of the signal as a function of range. And so, as Swaroon said, in a perfect world, this would be a very flat curve. It would just be a line that went, it's a function of power and distance. But because of all this variability, we see a lot of spread. So because the data is highly fluctuating, it really lends itself to detectors that are robust to highly fluctuating environments. So rather than trying to estimate the exact range of a person, we've tried to simplify the problem a little bit and think about it as, well, are they close or are they far? And can we get a collection of measurements to determine what is the likelihood of someone being close versus someone being far? And with the idea, and having discussed a little bit with the public health professionals and the contact tracing folks, it sounds like what is really useful is the first start to this problem is understanding, well, how close do you think I am and what's the confidence level that you have? And so this is an architecture that, or an approach that might lend itself to it. So if we can go to the next chart, I'll talk just a little bit more about what we did. If you think about grouping the data into close and far, you can generate statistics. And so what I'm showing here is actually what the statistics look like as a function of signal level, and what the probability of you being close or far given a specific threshold. And if you just take a single measurement, you're going to get very poor performance. So you're thinking about taking that dashed vertical line and just moving it up and down the curves. And you can see that from a single measurement, you're not going to be able to get that very high probability of detection without accepting a lot of false alarms. So what do you do with that information? We have highly variable signals. We have a very limited amount of ability to detect robustly in a single draw. So let's say this a bunch of times. So a very common approach in detection theory for fluctuating signals. Actually, if we could, just one more second here on this chart. We're looking at what's called an M of N approach. And so what this does is it allows you many observations of the signal under the assumption that at some point you will get some favorable observation. And from looking at a collection of measurements and counting how many times you get a strong signal, we can start to infer too close for too long from that statistic. And it doesn't just have to be the power level. You can look at the maximum level you see over an interval or things like that. So these are the kinds of approaches that we're starting to kick around ourselves, and we'd like to engage with the larger community. So if we go to the next chart, this is the last piece that I'm going to talk about. What could you do? So we need a lot of observations, and we only need to observe that strong signal a few times. But the more observations we have, the more robust performance we can expect to get out of a detector. So for example, if I have only a single observation, my probability of detection is going to incur a lot of false alarms. But the more observations I have, the closer I can move this receiver operating characteristic curve that John walked us through in his introductory remarks, the closer we can push that to the upper left corner in really more robust performance. Again, this is not a silver bullet. This is an approach to getting confidence in automated contact tracing that can augment some of the approaches that the public health department and public health staff are really breaking their backs trying to do. So what we're trying to do is augment them. In addition to the signal level, there's more information available, just like Swarun discussed. You might be able to reduce the uncertainty or increase the confidence levels by folding in information like your screen status, accelerometer data, any indicators of indoor versus outdoor. And this is, again, not the only way to skin the cat. This is a really fast way to get us up and running and get a handle on the problem right now. There are a lot of potential opportunities in the long term, looking at things like time of flight measurements and new features that will be rolled out in the next release of Bluetooth standards. So what I'm really trying to do here is just open up to our initial thinking about this and start a discussion and really help us walk through how we might use this technology in a privacy-preserving way to augment the public health operations now.
Sorry about that, user error. Let me get back to the slides here. Thank you very much, Jen. It is now my pleasure to introduce Han-Yang Tan from the Singapore Government Technology Agency, a lead developer of the Singapore Trace Together contact tracing app.
Hey everyone, hi. Yeah, I'm currently replacing Joel today. I'm actually the test engineer in the project. So I'm here today to talk about some of the challenges that we face during the development, especially when it comes to testing the Bluetooth RSSI data that we're getting from all the devices. One thing that I would like to go through is that we have run multiple trials, and we can categorize these trials into two different kinds. One would be the static trials, which is to address the for too long part of the equation, and dynamic trials or field trials, which we use to address the how close of part of the equation. So in Singapore, our health authority has denoted close contact criteria as 2 meters for a duration of 30 minutes. Currently, in the start of our development process, what we did was we had a lot of phones together in one single area, just to make sure that the data that is being transmitted across the phones is not only consistent, but also stable. And one of the challenges that we actually have faced for this kind of trial is that we realized that given a huge group of phones, say in a crowded public transport, some of the phones may not actually detect each other because of some nuances from manufacturers or otherwise the way we handle the Bluetooth protocol. So this was one challenge that we had to spend quite a bit of time trying to stabilize the stream of data we're getting, so that we can see the number of points in this 30-minute window is sufficient to say that this person is a close contact. A bit of information on our national deployment numbers. Currently, we have about 1 million users at the moment. That's about 20 of the here in Singapore. Also noticed that the cases that we are handling at the moment, infected cases coming in, about 1 in 5 of them do have the app installed. However, we have kind of tried to tune our algorithm here so that we can eliminate the number of false positives as much as possible. So far, we have kind of succeeded in that. We have set quite a, I would say, low threshold for cutting off the RSSI data at the moment, which is a hard number we use. This will determine if the person was within 2 meter radius. And I think right now we've only faced one case of a false positive where these two people were actually neighbors and there was a wall between them, but it was still flagged out as close contact due to the RSSI data we got. So as you can see, it's not reliable to have just a hard cutoff here. This is something we're still tuning, of course. And one other case we also had was that we had 2 cases with an app, and they actually bumped into each other at the same clinic they went for testing. So I guess you can say that so far the number of cases we have processed with the app kind of helps to corroborate our manual contact tracing efforts and confirming that, hey, these guys were actually in the activity map that the case has given to our contact tracers. So that we have seen some success in that area.
Great, thank you, Han-Yang. I appreciate that. I'd now like to hand it over to Joel Linsky. Joel is a VP of Technology at Qualcomm with over 20 years experience in Bluetooth technology and a longtime leader in the Bluetooth Special Interest Group. Joel, thank you for being here.
Thanks, John. So I'd like to start off with a little bit of an introduction to Bluetooth Low Energy advertising, which is really the fundamental piece of Bluetooth technology that's being used as part of this contact tracing. The first thing to note is advertising is a technical term because it is trying to denote devices that are actually kind of advertising a service or something to other devices in the area, but it has nothing to do with kind of ads or anything else like that. It's probably worth noting that when this is all talked about in the public sphere, that the word advertising isn't used because it's not a great term here. The way advertising works is that it transmits a very short data packet on 3 frequencies. And those 3 frequencies you can see in the plot on the left, which is the bottom of the 2.4 gigahertz ISM band, which is where Bluetooth lives. There's one about midway through, and then there's one at the top end of the band. And these 3 frequencies were chosen to avoid Wi-Fi interference, and they're common around the world. So any device that uses Bluetooth and supports Bluetooth Low Energy uses these 3 frequencies. The whole point of Bluetooth Low Energy when we started developing it, gosh, now it's probably about 15 years ago, was to be able to have very small devices that had, for example, coin cell batteries that could last for years. And so the idea was that with advertising, we would send what today seems like almost a quaint amount of data. We can send about 31 bytes of data in these packets, which is small compared with everything else that we do today, which is usually starts with a giga in front of it. But these short packets are great from the perspective of power consumption. So if you have a heart rate monitor or a sensor for a light switch, it transmits almost none of the time and has a very large gap before the next time. So the kind of the picture in the middle, the upper middle, shows that you send a short burst of 3 packets for transmissions, and then there's a gap and some randomization that occurs before you send the next one. The randomization is to try and prevent all of the devices that might be out there from advertising at the same time and blocking each other. So there's some jittering in the timing that occurs. And in the case of contact tracing, where we want advertising to be enabled on everybody's devices, that sort of a random jitter of time is super important. Now, when devices send these 3 packets very quickly and then they go back to sleep again, in order to pick them up, you have to listen for a period of time that is at least as long as that interval is between the packets. And so what that means is that you will see a long period of time that is dedicated for scanning as compared with a short period of time for advertising itself. And so the scanning side, to a certain extent, is more intensive and has more battery impact, but also has more impact to other parts of the system. For example, Bluetooth shares the 2.4 gigahertz band with many other technologies, but in the cellular sphere, it's mostly shared with Wi-Fi. And so in the phone, both Bluetooth and Wi-Fi, to a certain extent, have to compete for time. And therefore, we have to balance the amount of time that Bluetooth generally gets versus everything else that's going on in the phone. And one of the big challenges that we will find with contact tracing is that on one hand, we want to balance the speed and the number of packets we can get through for contact tracing. And on the other side, we don't want to impact battery life, and we don't want to impact the other things that consumers use in phones, because if there is a negative impact, there may be motivation to turn it off. So we have to be very careful on how we roll this out so that we don't actually kind of cause any negative effects on people's devices that will give them incentive to turn the whole thing off. If you go into the next slide. So what was said before by Jen Swaroon, there's a large number of factors in the real world that kind of get in the way of being able to accurately turn RSSI into actual meters. And these real world factors kind of fall into a couple different categories. One is more on the silicon side, and the others are more on the product side. And as I showed on the previous slide, where Bluetooth advertising uses 3 frequencies that are really spread across 80 megahertz. From a silicon perspective, a transmitter isn't going to be perfectly flat. It's not going to have this exact same output power across the band, and receivers aren't going to be flat across the band. So there's some variation that comes in there. And then when we measure RSSI, that has some level of inaccuracy because there's multiple gain stages, and as you convert something from floating point to fixed point, there's errors that creep in. So the RSSI measurements aren't perfect. And then there's the factors of, we tend to characterize kind of chips across large numbers, but we don't necessarily on production lines calibrate everything from chip to chip. So there's variations that creep in there as well. And then there's some issues that may not be as important from contact tracing, where you'll have variations that come in over temperature or battery voltage. And over the course of either 10 minutes or 30 minutes, these may not change all that much, especially if you're indoors. And then kind of lastly, on the silicon side, the way RSSI gets reported up to the part of the system that's going to need to process everything is in units of dBm. And so there's a little bit of inaccuracy that creeps in there. On the product side, as was mentioned earlier, there's antenna pattern issues. The filters that are chosen are going to be perfectly flat across the band. And then as Bluetooth is moving into systems and phones where there's actually is using multiple antennas, there may be different antenna gains. And so these sort of issues, when coupled with body area effects and the multipath and also obstacles like walls, create a bunch of uncertainty. And as was mentioned before, all hope is not lost, because there are a number of different techniques that can be used in order to try and help with this. And the first is that if you know more about the receiver and the phone's operating system can do that, it can help kind of calibrate out some of these issues, which is a good thing. Then the packet that gets transmitted over the air, it's one thing to measure RSSI, but if you don't know how loud it was transmitted at, then you have a lot of uncertainty. And cell phones these days can be up to almost plus 20 dBm in output power for advertising. But over the years, it was probably closer to about plus 10. So there's a large amount of variation. And including that information in what's sent over the air helps clear out that uncertainty. And then there's other things that we can do in order to try and limit the total range of Bluetooth. So for example, if you're in a Costco, we don't necessarily want every device within a Costco to be able to come into, have the data come in your phone and have to sort through all of that. If we lower the output power, we can kind of reduce the bubble and therefore have a smaller area worth of devices in order to, to sort this out. And then, as was indicated earlier by Jen, there's other state information that phones have that can kind of help filter this data. So for example, is the phone connected to a vehicle? Your devices today already know that. And if it is, then some of the information that you might be getting while you're driving can be filtered out. Also, if the phone has been stationary for a while, it's sitting on your desk, the certainty of whether or not you as the person are near that kind of goes down over time. So we can use that sort of information to help. And then other information may help being able to determine whether or not the phone is in a pocket, like whether or not the screen is on or not. And so there's a lot of these different factors that we have that kind of go beyond Bluetooth as a technology that can help kind of make sense of the RSSI information and help reduce the false negatives.
All right, thank you.
Thanks, John.
Joel, I really appreciate that. Next up is Doug Reynolds, a senior member of the technical staff at MIT with over 20 years experience directing and engaging in international data analysis competitions. Joel, I'm sorry, Doug.
Hi, thanks so much. So as my panelists before had talked, that you've gotten a description of what Bluetooth is, how it operates, the difficulties with it. Jen went through some of the nascent work on detectors and to overcome the real world issues. What I'm going to describe very briefly is just the framework that we're going to try to use to effectively use the different data sets that are being collected and leverage a wider community in the research community to bring to bear things that they can apply to help with the too close for too long detection problem. So as I said, there's a lot of the data that's being collected, and there's a whole host of this happening and being done in simulated and real world environments now. And we're going to be getting more and more of this. To maximize the utility of this data sets for the research community, we're going to be trying to provide some standards on data fields and formats, so it's not just silos that only the ones that collected it understand the ground truth and the measurements and what it means and the timestamps. And then we'd also like to gather and publish these data sets via a centralized website, so that now it becomes useful across and people won't duplicative effort or other things that they'll know what's going on in the research community. But most importantly, what I'm interested in is that we want to leverage the world of data scientists to explore modern machine learning approaches to by creating open evaluations. For example, if you look on Kaggle, which is a website that hosts machine learning challenges, they've recently had something called the Deep Fake Detection Challenge. It was sponsored by AWS, Facebook, and Microsoft. And it brought over 2,000 submissions around the world of machine learning experts applying the best ideas. And they did this by just setting up an open evaluation, defining some of the parameters I'll talk about next, and then releasing the researchers to bring the best to bear. Next slide. So what we need to do for putting together in a high level for the detection evaluation is we need 3 things before we release the machine learning crowd to bring their magic to it. First, we got to be clear about what we're going to define the task to be. What do we want it to do? We've heard the too close for too long. Basically, I think, and John had there, it was time versus distance. We want to harden that up and decide what we really want to measure the task. Then we have to have a metric on that. How do we know that we're solving the task? Jen put out an approach they're using from signal processing and have probability of miss and probability of false alarm. We want to know now with machine learning that everybody has the same ruler that they're using to measure their progress. And then, of course, it's all built on the data. We need to get the data, curate the data, provide training data for how the systems learn, development data to tune the systems, and evaluation to apply the metric and see how well it's working. The bottom line I'll wrap up with is by creating a common evaluation framework will allow researchers to compare results and build on each other's successes. And we've had this work in many different fields throughout my area, my time of working. Thank you.
All right, thank you very much, Doug. Our final panelist is Thomas Wiegand, Executive Director of the Fraunhofer Heinrich Hertz Institute and a leader of the PEP-PT contact tracing project. Thomas, thank you so much for being with us today. So Thomas, if you are speaking, you are muted. There we go.
Can I share something with your sharing, or is that not possible? I can, right?
No, go ahead. Why don't you share your screen? We can do that.
So I have to apologize. I'm too busy to prepare such great slides as you guys have. So what I want to do is I basically will tell you what we do and basically walk you through our, let's say, measurement report, okay? I hope that's going to be useful as information for you and maybe give you some ideas of what's happening on our side. So let me just share the screen. Continue. Okay. So I told you this is not going to be fancy, but I still hope it's going to be useful. So what we have done is we basically gotten the German army, the Bundeswehr, to help us test. So we asked for volunteers with masks so that we don't cause infections, and we then have put them through certain patterns. That was our start, and you will see in the report that what we have done there. We are about to move to a different setup where they all get UWB devices, which measure distance at about at about 5 centimeters accuracy. So that would be our ground truth. Before, the ground truth was just a protocol where they would walk through squares. So this is for that. We will do those measurements with the ground truth tomorrow, and about 50 soldiers with about 15 different types of phones will be interacting, and they can just do whatever they want, cocktail party or whatever they want. This is what we got now. We have done tests with different smartphone types and different positions of the smartphone, like back pocket, hand, and actually back pocket and hand is the two critical ones. And we would then, I'm going to get to that later. So we would then basically execute the test over multiple hours. They would be at 2, 4, 6, 10-minute time intervals, and we could basically have longer time events when we would track them across different rooms. They were like 50 soldiers distributed over 5 rooms, or no, 5 locations, inside, outside, 2 outside, 3 inside, and they would just be, you know, doing the protocol, so to say. And so we would have situations like that, and so we wanted to then use, we didn't even bother to estimate any distance, because distance estimation isn't really what we want. We actually want to estimate some infection risk from the RSS values. The RSS values are compensated between the phones through 4 mechanisms. So 2 of the mechanisms are static, and we are broadcasting an extra byte, which is a RSS compensation value for the sending phone. And we use a BLA broadcast for our system. And that static byte is also augmented by a variable byte, which depends on the position of your phone. We would measure about every 15 seconds, 10 to 15 seconds. So we are very careful with the scan, because the scan costs power, and we try to lower that power consumption part. And on the receiving phone, you also have a static antenna-based compensation, and you also have the variable compensation based on your position. We don't want to know, we are fully privacy preserving, so we don't want to know any of those details where you have your phone and what kind of phone. That's all, nothing that matters to us. So what we basically do is we calibrate all phones to one phone type, and we basically compensate through those 2 elements, the static and the dynamic one from the sender, and the static and dynamic one from you see my fingers, right? From the receiver, and we both use those to basically compensate that with the real RSS value, and then that gives you the final value. And we would then use logistic regression to basically produce, and we have scenarios with 2 people, we have them with 10 people, so we haven't seen any collusions with that. And so we basically then use those for the risk estimator. And we would then, let me show you so this is the epidemiological model. This is in centimeters. This is from Oxford University. Their team has developed a epidemiological model where we would basically be able to, the assumptions here is that within 1 meter, it's a constant risk, high, and then there's a quadratic diffusion model according to the droplet physics. We would then basically be able to have different plots of distance versus time. And so the principle it works is that according to the risk function, we accumulate points of risk over time. So when you're closer, you accumulate more points, and when you're further away, you accumulate less points over time. And then we would then go ahead and use that model, do the estimation, and at some point do a classification into dangerous, true or false. That's what my computer science guys use. So I need to tell them anyway. So and then there is a part that is really important, which is the macroscopic risk estimation portion. So when you the system that we are building is a pandemic measurement system, right? It is a it requires you to do a lot of tasks. So you have the proximity measurement and the information or the warning of a person. This is just start to end. In between, you have multiple aspects and layers of the system that you need to consider. So one is, of course, the random key generation, and to make it, and then the next one is the privacy preservation. The next mechanism is the transport layer. The next mechanism is the let me just, yeah, the pandemic management system, where you would basically follow at the server. You get, so what we do is we upload the proximity data to the server. We would then be computing a risk estimation, which is based on this approach. But then there is the the national public health policy that needs to be applied. That national health policy basically would be necessary to, for every proximity history that you get uploaded, be applied based on your considerations. And we are following an ethical motivated approach to balance to balance the considerations with regards to pandemic risk reduction, freedom of movement, and economic burden. And that pandemic, this national public health policy needs to be implemented at your server, and you need to basically then have ways of adjusting it over time. So you need to observe what's happening, how is your policy applying. So you need a validation, whether you're, is that?
Oh, sorry, Tomas. I took control of the screen back just so that I could get the next slide up. So.
Well,
thank you, Tomas. I really appreciate that. But tell you what, I'll hand it back to you because the very first question is for you. It is so now we're going to do some questions from the audience, and the first question is for Tomas. Is your report available to others?
Sure. I'm not done yet with my presentation. Do you want me to finish it or not?
Well, can you finish in the next couple of minutes so that we have a little time for audience questions?
Sure.
Yeah. Okay. Sorry about that.
So I'm going to share my screen again.
Yes, go for it.
So basically what happens is then you need to apply this health policy on your server, and you need to basically apply it in an ethical way so that people accept your system. What happens is you basically need to go through this process, and you need to essentially across those users over the proximity histories apply certain thresholds so that you can actually implement that. And this results basically in having these risk scores, and then having a decision on what's your policy, and then you basically get those 4 squares, and then you get different true positive rates, false positive rates over the AOCs. So that's basically what I wanted to tell you. So it wasn't almost done. I was almost done.
Sorry, I've been a little too quick on the trigger here. This Zoom webinar is new to me. So, all right. So thank you very much, Tomas. I appreciate it. Thank you to all of our panelists. We now have approximately 10 minutes for audience questions, and some good questions have come in already. The first one I'm going to direct to Tomas, simply because he was the last one up. And I think we're all curious. Is your report available, or will you be making it available in a more public or even controlled form of dissemination soon? That's a beautiful looking report.
We're planning to do that, and we will be available soon.
That's great. Wonderful. Thank you. It looks like you have a wonderful test protocol and lots of really great data there. I wonder, turning it over to Doug just for a moment, if those kinds of data might be integrable into your sort of proposed open data framework.
Absolutely. I mean, that's a perfect example there of They collected it. They had the ground truth. They've defined a metric on there that is repeatable. And that sets itself up very well to taking that, having the same experimental protocol with the metric, publishing it out, and letting people then apply the best ideas they can of machine learning or other approaches to see how well those do compared to what's been worked on.
Great. So the next question, actually, which we received a lot from the audience, is, well, Bluetooth seems to kill my battery. At least, I'm assuming people's experiences with connecting peripherals like heart rate monitors and AirPods and whatnot. And so let me first pose this question to Joel, and then maybe get some practical data from Han-Yang and Tomas from all of his testing. But why would we think that this particular mode of Bluetooth advertising and scanning, or possibly establishing persistent connections, as I believe the Singapore Trace Together app does, would be less harmful to battery life than what we experience when we're using AirPods?
Well, I think it mostly comes down to the fact that many of the aspects of Bluetooth advertising are already kind of enabled on your phone anyway. So one of the nice things about being able to scan is that you pick up any packet that is going to be out there, and it's not specific to contact tracing. So from the scanning side, there's really not much different compared with what's going on right now. It's just more packets will show up. On the transmission side, there will be 3 more transmissions that are sent periodically, and there's going to be a little bit of power consumption associated with it, but I think we're all very conscious of this, and that's something that is going to be managed as best as possible. So I think the goal is not to have any noticeable degradation in the battery life of your phone.
Great. Han-Yang, would you be able to share some of your experiences with the Singapore Trace Together app, both possibly with real world observed battery use, but also some of the other things that you had mentioned in a prior conversation, the difficulty of keeping the app running in the foreground and the screen on and those sorts of things? How have you overcome those challenges?
Yeah, sure. So I guess in our own static trials, we have noticed that the battery consumption isn't really that much. However, we do acknowledge that we have had reports from our users that the battery drain is significant on their devices. This is something we're still looking into. But one thing I do have to say we have observed is there is some like Bluetooth peripheral interference reported by some of our users, meaning to say when they are listening to their music, they get interruptions in their broadcasts due to the app. Like when they switch off the app, it seems to get better. So this is something we are also looking into trying to fix at the moment.
Great, thank you. Tomas, any experience with your tests that you'd like to share with regard to sort of how it performs on the phone and whether they had to be kept in a particular mode, foreground, background, screen on or off?
So I can basically second what Joel said mostly. You can change the scan mode to different types, I think. And since you only are needing a measurement like every 10, 15 seconds, you can basically be very loose at scanning and still catch sufficient information, and then just not scan for a while through this. I don't remember which of the 3 scan modes uses the least battery, and the sending is really more often than not. So if you miss a 10-second interval, it doesn't matter. At the end of the day, you are looking at sufficiently long measurements, and we are even considering lowering those 10 seconds to 30 seconds or something. And we just tried, and once we went to those time intervals, there was no congestion problem at all. And so yeah, the Bluetooth measurement and the privacy preservation stuff and the transmission protocols, I consider those things as done actually.
Great, wonderful. Well, thank you. Another question from the audience for Han-Yang is, in your experience, what percentage, if you know or can say, what percentage of the people who were flagged by the Trace Together app as having had contact actually became infected?
This is something that I don't really have much clarity on because this is owned by the Ministry of Health over here. So I'm sorry. Yeah.
No, that's quite all right. That's why I threw in if you can comment on it. I'm glad to know that you're treating those health data as private. Do you have any indication as to whether it's roughly comparable in efficacy to the manual tracing efforts? Because I know you have very significant manual contact tracing efforts in Singapore.
Well, I did mention previously that yes, the data that we get from Trace Together does help to corroborate whatever we match from the activity mapping, the manual activity mapping we get from the infected cases. So yeah, that is helpful to the contact traces.
Okay, great, thank you. So the next question that we have here is, are there other sensors that we could consider? I know there's been some discussion of this already. Ultra wideband would be great if we all had the latest phone and had an ultra wideband chip on it. Yes, I know. But keeping in mind Louise's earlier comments about serving the underserved, the young and the elderly who may not have the newest devices. I know I don't trust my 7-year-old with an iPhone 11 Pro. But are there other sensors that we could use? Or is, as Tomas says, is the Bluetooth input to the infection model essentially a solved process or a solvable process?
It's for iOS and Android phones, but that's actually something that we are working on. So what we have is you can implement this on Bluetooth beacons that are about $20–30, and we are going to be going into production with them in the millions towards August, so to catch the September wave, and we would basically be giving those, and they would still use the RSS measurement because they have to be integrated with the system, right? And we would be giving those to kids under 10 and senior citizens under 70, I guess. Those are the two groups that really need them, and you don't want to, some of the kids you don't want to trust with the phone, and the older ones don't want to use it. So here we go.
And something that I'd add to what Tomas just said is that the technology that at least we're using on the Bluetooth side, we're not using anything fancy. I mean, this technology was really from 2010. And so it's had a huge amount of time to get into all the different phones. I mean, virtually every phone sold today has Bluetooth. I think the place where it's a little bit different is whether or not the operating system is something that can more rapidly be updated in order to take advantage of the contact tracing from more of an app perspective. And there's certainly going to be some percentage of phones that are more of the feature phone the style that may not be able to get that quite as fast. And that's where something like what Thomas is mentioning, of either having a wrist-worn type of device or something else may be able to complement that.
Right. Well, I would like to thank on behalf of me and the audience and the organizers, our panel for participating. It was really wonderful. I apologize for the technical difficulties that I experienced on my end. But thank you for bearing with me through all of that. Thank you to our audience for asking such great questions. It is now approximately 12:45 by my clock. That's Eastern Daylight Time. Thank you to Tomas for participating later in the evening, and for Hanyang, where I believe it is close to 1 o'clock in the morning. So thank you very, very much for that. We're going to take a very short break now, just under 5 minutes. If everyone could be back at 12:50, or what is that, 16:50 GMT. Thank you.
Thank you.
Thank you.
Welcome back, everyone, to the imPACT 2020 conference on automated contact tracing. We have over 1,000 people joining us now on the stream. I'm going to now introduce Dr. Emily Shen, who's going to run the next panel, moderate the next panel. Emily's a technical staff member in the Secure Resilient Systems and Technology Group at MIT Lincoln Laboratory, and she's the technical lead of the PACT Cryptographic Protocol Working Group. Go ahead, Emily.
Great. Thank you, Danny, for the introduction, and welcome everyone to the final session of the day. Let me share my screen. Okay, so this session will focus on the privacy and security properties desired from contact tracing systems and cryptographic protocols that have been proposed to achieve these properties. For today's session, we'll be focusing our attention on protocols that aim to preserve privacy within a decentralized architecture. There have been a number of recent proposals of this type, and these proposals have many commonalities as well as some differences in the details. The goal of this session is to discuss how the community can best move forward quickly and productively, and to identify paths toward convergence. We have 4 distinguished panelists who have each worked on developing recent private contact tracing protocols. Our panelists are Stefano Tesaro, who's an associate professor of computer science and engineering at University of Washington, and a member of the privacy-sensitive protocols and mechanisms for mobile contact tracing, or PACT team. Carmela Troncoso is an assistant professor at EPFL and a member of the decentralized privacy-preserving proximity tracing team, or DP3T. Henry de Valence is a cryptographer at the Zcash Foundation and is a member of the Temporary Contact Number, or TCN Coalition. And Ron Kennedy is a professor of computer science at Boston University and a member of the private automated contact tracing, also known as PACT team. So each panelist will speak for about 5 minutes on their high-level design principles and the approach behind their proposals, and their thoughts on how the community can best move forward quickly and productively. Then we'll move to questions and discussion. And without further ado, we'll start with Stefano Tesaro from University of Washington and the privacy-sensitive protocols and mechanisms for mobile contact tracing, or PACT team. Stefano?
All right, thank you very much, Emily, for the introduction, and thank you for having me here. So let me spend here a few words on describing our PACT protocol. So note that there is a naming collision here with the project hosting this event, which is unfortunate, but was of course unintentional. So this is a different project that involves a number of researchers and volunteers, and it also underlies an open source app called COVID Safe, which is currently being developed at the University of Washington and by volunteers at Microsoft. So PACT proposes a privacy-sensitive Bluetooth-based decentralized contact tracing protocol. And at the high level, the protocol resembles those of other proposals you're going to hear about. So users broadcast anonymous and random-looking IDs over Bluetooth, which are then collected by other users in proximity. And upon reporting positive, users just upload some information about their own IDs that they have a broadcast to a server, and this then allows other users who have been exposed and are at risk to learn that information privately. Now, in addition to security and privacy, so one goal here was simplicity. So in PACT, because of the way in which IDs are cryptographically generated, so each upload of the server consists of one single very short seed. So this reduces both bandwidth and storage. So these broadcast IDs are pseudo-random. So what that means is that they look random and unrelated to any other information. So this ensures that the identifiers do not leak any information about non-positive users. So an important class of attack that we want to protect against beyond privacy are replay attacks. So what that means is that we want to prevent IDs that are broadcast by a user at some location to be rebroadcast by a malicious entity at some other location, also at a different point in time, as this will seriously endanger the reliability of the system. And also what we want is another property that called forward secrecy in cryptography, which is in this context makes sure that upon device compromise, for example, the phone is hacked or is seized, a malicious entity cannot infer whether the user has reported positive or not at the prior point in time. Also, and I just briefly mentioned that PACT offers some other functionalities which are helpful to support health services and which by design do not affect the privacy of users. So for example, we offer a narrowcasting functionality, which is meant to alert users of relevant information relating to their recent locations. So maybe on the second slide, I want to share a few thoughts for the panel. So one point I really want to stress here is that this is a quite unique situation from the perspective of cryptographic engineering. So we really want to deploy at scale and fast. And this is actually something we normally do not want to do in cryptography. But this is just due to the events, that's how we need to operate. And definitely one challenge here is interoperability, which I hope we're going to discuss about. So adoption here is clearly a key for success, but we have now several independent solutions that ideally should interoperate. And this is actually not trivial at the engineering level, even though the protocols look similar. And also one fear is that interoperability increases complexity. And we have seen this happening in other contexts that in turn, from a software security standpoint, this also increases the risk for vulnerabilities. Another thing that I think we should address is the fact that all systems, including our own, require some sort of validation by health services to upload information to servers. And this cryptographically requires some form of signing, which requires some trust infrastructure. And it would be good to have a common approach to this, which is shared by all apps. It would be absurd if a certain service, health service, cannot upload, validate information for a certain app. So another concern is that personally I have is that even though the problem appears simple at first to cryptographers, I really envision new ideas coming up in this space as we face public scrutiny. This is in fact already happening to a certain extent. We thought of alternative protocols that might be viable, ideas are shared publicly in the community. So one thing we should really think about is how future-proof our solutions are. I mean, it's very hard to make changes. And then finally, just a final remark, I'm really hoping that we can find good platforms for protocol designers to discuss together across teams. This panel is definitely one excellent starting point. So thank you.
Thank you, Stefano. So next we have Carmela Troncoso from EPFL and the Decentralized Privacy Preserving Proximity Tracing, or DP3T team. Carmela?
Thank you, Emily. First of all, I have to say I'm here representing a big group of people from different countries and institutions in Europe. And so we came to this problem because we were invited to participate in the Pan-European Proximity Tracing Initiative. And when we entered this project as researchers that come from the cryptography and the privacy domain, I'm actually, I think, the only non-cryptography in the panel. I'm actually a privacy researcher. And as such, when we started thinking about what protocol to build, our main philosophy was do not harm, right? In the beginning, we had in the discussion about how contact tracing could help, that maybe it does not help. We don't really know if this is going to help or not. So from the beginning, we decided that we wanted to introduce a technology that does not introduce new problems. And how did we aim at doing that? By starting with a very, very limited purpose, which is we need to be able to notify at-risk users, as we have seen before and as other protocols do. And we need to provide information for epidemiologists to tune the policy. So right now we have this World Health Organization, 2 meters, I think that was 6 feet. I'm sorry, I'm not very good at the non-European measures, and 15 minutes. And for that, we work very closely with epidemiologists to find out which is the minimal set of data that allows us to achieve these two purposes and make sure that there is no other data in the system so that the system cannot be reused or repurposed to abuse and to have further consequences for users, their privacy, security, or any other. And where are we here? We have actually 2 protocols, which I will speak about them in a minute. One that is very low cost, similar to all of the other protocols that I believe we will be talking about today, and one in which we made more effort in making the different ephemeral identifiers unlinkable, stemming from feedback that we received from civil societies. We have released this week our first SDK in our repository. And when yesterday we talked in this panel, I said that our first kind of priority was to develop, right? We're in Europe, we need to come out as fast as possible. We're talking with several governments, among them the Swiss government. We need to get out of home, so our first priority was to produce our pilot. But as of this morning, we have discovered that apparently we're not part anymore of the pan-European proximity tracing. We disappeared from their website. We had no notification of this. And we wonder what then is this pan-European gonna implement, because there is no public document. So at this moment, we think that it's very important that the academic community that is starting working on this, we get together, we agree with Stefano that interoperability, whether it is the same protocol of how we find a good way of actually interoperating, and the moment that we are all uploading the infected people identifier, I believe that it is feasible, and talking together we can find a simple way. We have started conversations with the TCN network on this, and we want to jump as soon as possible. So let me just introduce our two protocols. Next slide. Yeah. So the first one is, as everybody else's, kind of, we have a seed that rotates over epochs, and this seed is used to create ephemeral identifiers using a random number generator. And whenever somebody tests positive, the seed is uploaded to the backend server, and all of the other phones download the seed. So I don't want to spend much time on this because I think that everybody has seen these protocols enough. And that was our first proposal, but after a week of this being on the repository, we had a series of meetings with different data protection authorities, with the European Data Protection Supervisor, and we had 2 webinars with civil societies, and it came out that it was not very well regarded that actually one could enumerate all of the seeds of and all of the ephemeral identifiers of everybody that was infected, even though from a hardcore security perspective, this does not give any information. It was not well received, and adoption is very important. And also the linkability that using a seed provides was not also very well received, because that may allow people to know whether they have seen somebody twice in a day or twice in a week. And also people express the need to be able to redact. What happens if I want to remove one day or one afternoon? So we came up with a second protocol. Is the next slide, please? The next one, yeah, which we call the unlinkable protocol. And here again, we have a seed, but instead of developing from the seed, every time we need an ephemeral ID, we take the hash of a new seed, we truncate it, and we use that one. And how it works is that the difference before the with the previous one is that now infected users will upload all of their ephemeral IDs. That means that if they want to remove some, that is not a problem. And in order to save bandwidth on the downstream, we actually the server would convert all of those into a cuckoo filter, and then this is what is downloaded by the different clients that can check whether the IDs they're observed are in this cuckoo filter. So this provides us the linkability that we want, because now ephemeral IDs are not derived from the same seed. This provides us with the redactability civil societies asked us for, and it also provides the capability to not enumerate, because it is easy to check in the cuckoo filter whether an ephemeral ID is inside or not. That's very efficient, but it is very hard to actually enumerate all of the ephemeral IDs that have given rise to this cuckoo filter. And that's all I wanted to discuss. I would be very happy to hear about why our colleagues and my colleagues did think that unlinkability was not a reason. We also thought, it was not needed. We also thought that it was more important to keep bandwidth, but it turns out that the end users seem to actually freak out at that possibility.
Okay, thank you, Carmela. Next, we have Henry de Valens from the Zcash Foundation and a member of the Temporary Contact Number, or TCN Coalition. Henry?
Hi, my name is Henry. As mentioned, normally I work at the Zcash Foundation on privacy-preserving payment systems, but for the last few weeks, I've been working on cryptography for privacy-preserving contact tracing, and specifically with efforts on the TCN protocol. So this TCN coalition is it's a decentralized organization trying to coordinate different open source contact tracing apps to use a common protocol. So a lot of different open source apps have been launched, or efforts to develop them rather. And this originally started as just an effort to collaborate between two different apps, COVID Watch and CoEpi. And it's now snowballed, I think, into half a dozen or a dozen different applications using this protocol. And that protocol is the TCN protocol. It works pretty similarly to many of these other protocols. Devices generate pseudo-random contact numbers and then broadcast them over Bluetooth. And later, users can publish reports that notify other users of potential exposure. We chose the name contact number rather than, say, like a rolling proximity identifier or a ephemeral ID, because if you just say the word identifier, the immediate impression that it gives is that it's something that's doing tracking, even if it is sort of then ephemeral or something. And currently we have a 0.4 version of the protocol. We have implementations in Rust, Swift, and Kotlin, and a basic protocol simulator that can simulate different users of this protocol interacting with each other. And it's currently being integrated into the mobile applications from the organizations that are part of this coalition. The reason that we put a version number on the protocol is because that way all of the different application developers can continue to iterate on developing their applications at the same time that we iterate on the protocol design. So we're currently working on, or starting to work on, an 0.5 version that we hope can incorporate all of the different ideas and improvements from other proposals and work toward either interoperability between all these different approaches, or perhaps just having like one protocol that sort of encompasses the best ideas. And all this development is done in the open. So if you just search for TCN Coalition on GitHub, you can find all of our documents, design discussions, etc. And we've written up a contact tracing Bill of Rights with what we think are sort of baseline requirements to respect users' privacy and autonomy. And to one of the points that Stefano made and has been discussed elsewhere, the kind of basic cryptography of generating identifiers and doing matching is only really one part of the problem. And another really big question is, under what conditions does someone actually send a report? So one possibility that you could do is you could allow self-reporting of symptoms, or you could have authenticated test results. And as soon as you have some notion of authentication, you have to have some notion of like, who is allowed to authenticate, what is the process for that? And this is really operationally difficult, because even in places like, as was mentioned earlier, Massachusetts apparently has a very effective system for tracking infections. The data flow for doing like statistical tracking of what infections have happened is quite different from the data flow that you need to sort of have an online service that can authenticate reports. And so in the protocol design that we did, we decided to make the protocol agnostic to that decision, so that the underlying protocol that's hard to change after it's deployed doesn't make one firm decision or the other, or presume the existence of a single centralized entity that can verify tests for the entire world. And to do this, what we did is all of the reports include a typed memo field. So different applications can put different data there depending on the application. So for instance, if someone wants to have an application for opt-in symptom reporting, they could do that by having like a bit field of symptoms. Or if you want to have contact tracing with authenticated test results. You can put in a signature from a health authority, and the decisions about what actually is the sort of trust infrastructure for doing that corresponds to the test infrastructure is moved out of the base protocol, because this kind of contact tracing effort kind of presumes that there is in parallel going to be a big scale up of testing capacity. And it's hard to know in advance exactly what that will look like. So we tried to be sort of as extensible as possible. And finally, I wanted to make sort of a few comments on some of the discussion about Bluetooth range estimation. So I think that there might be a slight kind of impedance mismatch between the sort of radio category and the cryptography category, which is that a lot of the cryptographic proposals seem to assume that there are relatively few broadcasts having numbers that sort of rotate every few minutes or something. If you were to broadcast those every few seconds, so that, for instance, you could do M of N approaches for Bluetooth range estimation, then you have a linkability problem, because if you imagine that there's someone who's listening, like some ad network has Bluetooth measurement stations, and they see someone go do 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 do, and then suddenly switch, then they can infer that the number that disappeared and the number that suddenly reappeared are linked. So I just wanted to flag that as a potential challenge.
Emily, I think you're muted.
Sorry. Next, we have Ron Canetti from Boston University and the Private Automated Contact Tracing, or PACT team. Ron?
Hi, thank you. So I'm representing the East Coast PACT team. So also, I'm not really representing the official opinion of the team. I mean, I'm representing ideas and thoughts that we discussed, but opinions are mine to a large extent. Anyway, so I wanted to start with an analogy, maybe a bit extreme, but I think it's good to have as a reference. So, in 1945, the atomic bomb has ended the World War II pretty effectively. However, it also changed the world forever. And not always for the best, right? And so what we're trying to do here, it's a far cry from atomic bomb, but what we're trying to do here is to end or to help mitigate the pandemic without creating a long-term effect on society. In particular, without long-term harm to civil liberties. And I'm specifically using the term civil liberty as opposed to privacy because there are, it's a different issue. Slightly different issue, although we're talking about the same things. It's kind of a large-scale violation of privacy. So in particular, the principles, of course, that led us is no storing of locations and movements of people, not even infected ones, should happen, like Carmela was saying. So this is kind of a no-no. And then we want to, in general, to minimize this trust in a centralized authority as much as we can. And we want to have a system that respects the choice of individuals, have voluntary participations, and more than just voluntary participation at the entry level, at every step of the way. Whenever you want to opt in more, it's up to you. So you basically control the loss of your privacy versus utility to yourself or to society. And of course, we wanted to insist on being visible, being simple, being open source. Everything should be out in the open, transparent, and understandable as much as possible. Right? And this is crucial. And I think there's a general lesson to, or a general point to be made here to society that that liberty can be preserved, and if you use the technology right. I think it's really important point. As as Government Baker said a couple hours ago, it's beyond the here and the now. So maybe next slide. So how do we succeed? How do we get this show on the road? Because it is, to us maybe natural by now, but it is a bit of a non-traditional revolutionary idea to societies and definitely to governments, right? So how do we succeed? So first is so I want to say actually that I'm not going to talk about the principles of the protocol. Protocol works because it works in very much the same way as what Stefano would describe in Carmela and many others. The ideas are the same. So let me talk about other things. So how to succeed? So the first thing is to have a good user experience, right? So they have to be the app should be informative and not annoying, and allow for gradual and voluntary, as I said, engagement of users, and in particular to have smooth transition to assistance from health authorities, health professionals, and authorities in general. So that's here the user experience is really important, and beyond the Bluetooth and the technology, that's in some sense will make or break the success of this. And we should be in particular open about the security properties, the good and the bad. There should be no surprises to users, right? So we've seen all kinds of people coming up with different attacks, which kind of like inevitable or not, but we should be open about those things. And we should mitigate kind of big brother fears that we've seen. I mean, even as soon as Google and Apple announced their participation, immediately we've seen these headlines about how yet another way in which Google and Apple are going to track us all. So one needs to be really careful about how to mitigate that, because this is exactly not what we want, right? And I think it requires all of us to work in concert, with some common sense of principles that hopefully we'll manage to agree on to kind of like give the same message to everybody. And of course, we want to have better understanding of the security and the properties that give even more better protocols and modeling analysis for academics, for years to come. There are things to do, but yeah, maybe that's for later. So next slide. Okay. So in this vein of first transparency and second maybe getting some common ground. So I tried to kind of list some hierarchy of different attacks and harms against collocation schemes, and just to put things in context about different scales of the different importance of attacks. So maybe the first thing that I mentioned they want to protect against is this large-scale collection of location information of everybody, both infected and uninfected people, right? I mean, assuming that a large fraction of us are going to be infected at one point or another, so we all, should care about the privacy of infected people. So that's the one thing we want, the worst thing. And of course, there's the smaller version of this, of more localized or targeted collection of location against specific areas, specific people. Maybe that would involve actually being specifically there, and then you can locate, identify people or location of people there. So that's a more restricted form of this attack, which it's much less harmful than a large-scale version of it. Then, of course, there's the other attacks of false alarms. It's going to be really bad for the system, definitely if it's large scale. If it's localized and targeted, small scale, we can probably live with it. And then there is this, all these attacks of identification of who is infected and who maybe infected me. And that's kind of another level of attack, which I personally think is less of an issue than definitely the large-scale collection of information, although it's of course bothersome. So also here there are levels, right? So can I, can I re-identify a person that infected me when I was there, or there's a larger scale way of doing that? And so it's important to differentiate between those things. So currently, the schemes that we all discuss have a pretty good protection against all of these attacks, against maybe the last kind of the more local versions of the identification of infected people. Because there are ways in, with those schemes to re-identify and take pictures of people around you, etc., which have been, have been discussed. But it's important to note that this is kind of like somehow low or very low on the scale of harm, so that such a scheme can inflict on people. Also, there are ways to mitigate even these. In fact, we are working on those on some in our team, and I'm sure other teams are working too. And there will be papers that describe how to get even that with more crypto. It's going to be more heavyweight and less simple and understandable, but it's going to be out. So actually, we consciously decided in our initial version to leave all those mitigations out, even though we know more or less how to do them, just for simplicity. Okay, so maybe next slide. So again, so now how to go forward? I mean, how do we get the agreement? What issues do we have to deal with now? So here's some things that I think are pertinent. So first is again to clarify the main differences between the proposals. So what are these? So from some kind of like from a scan of the proposals, that Emily did and I did and others did. So the main issue is that this ABC is this different changing mechanisms for uploaded keys that Carmela was mentioning before. This trade-off between linkability and space and efficiency. And this is a trade-off one has to decide. We can leave it as a knob to turn for for a particular implementation. I happen to agree with Carmela that unlinkability is important, and it's actually worth the extra space. So in our proposal, we did this chaining on a unit of an hour. Every hour, it's going to be a new chain and unlinkable. I think in the Google Apple document, it's a day. One can argue and set whatever you decide. So that's a parameter. And then there are different ways to mitigate against some of those replay civil retransmission attacks that each system has its own mechanisms. We can maybe try to agree on a standard set of mechanisms, or maybe not. I mean, it goes down to my third point. The second issue is how to work with Apple and Google. Once they came in, of course, they kind of like they're going to attract a lot of the attention of the public, and we're going to have to work with them to something that in the end that's going to be on the phones. So one issue is how to guarantee openness and verifiability of the code, right? So I think everybody here speaking, is for open source, completely open and verifiable, inspectable, scrutinizable code. It's not clear how it's going to work with Apple and Google, but we should maybe work with them to get at least part of it, or get making ways for making this as open as verifiable as possible. How do we guarantee compartmentalization of information with the rest of the OS, so there's no issues within those phones? The last thing that we want is some ad server to serve to the phone ads for infected people, and as soon as it found the chirp that was infected on the phone, so even if it's not exactly a security breach, and then who will run the backend server? That's another question. And then finally, I want to say a word about interoperability, and I think it's a very it's a complex question. So first, should we interoperate? It's not clear because, of course, different apps and different even implementations of the same app, which turn the security knobs differently, maybe you don't want to interoperate because maybe you'll get the worst of both worlds. So we don't, so interoperate in terms of being able to transfer chirps or tokens between one and the other. Having common language of standards, that's a different issue. However, maybe we want to interoperate at least on the Bluetooth level. So that's different levels again of interoperability. And then there's the issue of, do we want even apps to exist on the same phone? I mean, forget interoperability, because people will be moving around with different apps. Is it good? Is it bad? Can we deal with it? Should they use the same Bluetooth on the same phone for different apps of chirps? I mean, it starts to look like a mess, but we have to think about what we want to do there, because it will happen. So that's it.
Okay, thank you very much to all the panelists. So now we'll open it up to questions that the audience can submit through Slido, and I have a few questions to get us started. The first question is, so we have seen these numerous protocols that have many commonalities and some differences, and the question is, should we be aiming to resolve these differences and converge to a common cryptographic protocol, or should we be focusing on making the different protocols interoperable? And how do you recommend we achieve that? Stefano, I'll start with you.
Yeah, so that's definitely an excellent question, right? And I think that's the first question you would like to ask. I think ideally in the standard process of cryptographic engineering, that's what we should be aiming to do. I don't think this is very feasible. Maybe I'm a bit more negative than others here. So the apps are being developed as we speak. It's very hard to have agreement on this as we go forward. So I'm not sure. So this is something that I'm happy to discuss here in this panel, but I don't think we can really do much about it in the long term. That's also the thing that I was referring to as being future-proof. I mean, what happens if in the longer term, say within a few months, we can agree on a protocol, or is it something we can envision adopting at a later point in time? But I don't expect realistically this to be something we can do in a few weeks or the few days that we need this to be done.
Okay, Ron?
So yeah, I want to add, I agree, and I want to add another point. So it's actually a point that I wanted to say that I kind of forgot to mention. So I don't think any of us will really know how this is going to work until it's out there and it's tested and it's experimented. Because there's so many variables. What security issues will come up or not come up, and what will work. And of course, in different places, different results of the experiment might show. So maybe we don't want to interoperate right now. Maybe we want to actually have as independent experiments as possible. And after some experience comes up, we'll see what works and what not, and then we can reconvene and try to get some understanding of that. I don't know. That's
Carmela or Henry, do you have anything to add? Carmela?
So I kind of agree with Ron that at the speed we're going, maybe it is not possible for us to agree right now because we need to implement. So the interoperability at a higher level may actually be interesting. I think we should have a bit more conversations about whether the BLE is even relevant, because at the end of the day, these are identifiers, these are bits, and when we compare on the phones, these are bit strings, so that doesn't seem very important to me, but we need to have a way of recovering those bit strings from the different protocols. And the other thing, and this has appeared a couple of times at the end of the day, is about how we reconcile whether we have an authorization mechanism and how do we reconcile different authorization mechanisms. And this is one of the parts that we are developing right now in conversations with different health authorities. I think it was Luis in the beginning that says that this has to be modular. So we're trying to actually kind of separate what are each of the different functionalities so that we can reduce to the minimum the things that need to change from system to system. And we will also be very happy to actually share this experience so that we make sure that also from that perspective, we're interoperable, because we cannot forget that the crypto side is just a very small part on the huge mechanism that contact tracing is and how many different actors are present. So we need to think about interoperability in all levels.
Thanks. Henry?
One sort of principle or metaphor that I think would be helpful in thinking through this is this idea of having a single well-oiled hinge that I think is due to Adam Langley and came from experience on TLS, which is, as one of the most widely deployed crypto protocols ever, has really learned a lot of lessons about interoperability. And essentially the principle is that you should just have one, rather than having a bunch of different mechanisms that can combine in different ways to do interoperability, you should have sort of like one hinge, and you should make sure that it works by actually exercising it with upgrades. So I think that maybe given all of the considerations that have been mentioned by others, I think that the point that Carmela made about the sort of need for speed is really critical. I think that it may be a more promising path to try to have each protocol just have its own version and attempt to iterate on those versions.
Thanks. Okay, so given what the panel has said about the need for speed and that might point to focusing on interoperability more than standardizing on a common protocol, I wanted to talk more about at what layers you think these systems should be interoperable and how we can achieve that. And there's also an audience question about whether it's possible to achieve interoperability between a decentralized system and a centralized one. Carmela, could we start with you?
I actually think that the interoperability does not depend about centralization. And I understand centralization as where the matching between ephemeral identities take place and who decides how to show the notification. In a decentralized system, this happens on the phone, and the phone decides to show the notification. In a centralized system, this happens on a centralized server that sends notifications. But now this is not what defines interoperability. Interoperability is defined by what we upload to this server, right? And all of the protocols we have talked about upload the infected, while many of the centralized proposals we know about upload the observed, that we call sometimes at risk, so the people that have been close. And then as far as we have tried to come up with situations, that is kind of not possible to reconcile, because now you're trying to match bananas and potatoes, right? So if we want to have interoperability between centralized and decentralized, they must upload the same type of information. Otherwise, we're just making one of them send the same thing as the other. And that particularly defeats the purpose of at least our design decision of uploading the infected identifiers, because they do not reveal any relationship edge in the social graph, which I believe is the same as everyone else here.
Okay, does anyone have anything else to add?
I think sorry, yeah. So I wanted to say one, but I think there are different levels of interoperability, and we should think about, so if you think about cars, right? You can think about interoperability in terms of having many cars on the road and and work together, and as opposed to interoperability of getting a wheel from one car and a seat and engine from another car, and try to make them work together. And I think, of course, the one works, the other doesn't, and we have to think. I mean, what do we think about it? What do we mean? Is that like I send the chirps from one scheme and it's understood by a phone using another scheme? That's not clear, right? There's a beyond the technicalities of crypto algorithms. I'm sure we can do. The whole security mechanism, may be broken. So. And do we want to have different applications, different databases in the same city? Obviously not, right? Because it's just like diminishes utility. So I think we're left with having different schemes in different places that you move from place to place and how to make them work. Yeah.
Stefano?
Yeah.
Yes, just to iterate a bit more on RAN, I think if you forget the cryptography, I mentioned this before briefly in my opening slides, but if you forget cryptography, we have significant experience in the past of things that have gone very badly when an application tries to even support different versions of the same protocol. I mean, think about TLS and downgrade attacks and all sorts. So if what interoperability means is having one app or each of the app support different protocols. I mean, I'm imagining something where you collect identifiers that might be the same process or tokens or whatever we want to call them, and then you just upload them according. And then but however you interact with backends from different apps. I'm expecting that this might open the door to all sorts of software level vulnerability. And as we are developing these apps very fast, and many of them, I'm really concerned about that. And then also, as Ran said, I think the main question we have to ask ourselves is how are we intending to, how are these apps intending to coexist, right? So are we thinking about them being deployed in different geographical locations? Then it's really not that important, right? Are we intending them to coexist in the same geographical location? Then it really makes sense to think hard about the problem, because then we reduce the impact of each one of these apps.
Henry, do you have anything to add? Oh, sure, Carmela.
No, Henry, please go ahead.
I guess with regard to whether there's going to be sort of one or several apps, I think that it's because all of these apps are going to be installed on a voluntary basis. I think that it is not realistic to expect that there will be one app in any given region. And so I think that we are kind of faced with the problem of having interoperability head on, and that there's unfortunately not really a way to avoid it.
Henry, I'm wondering if, as a member of the TCN coalition, who's sort of combined forces from a lot of different proposals and specifically a couple, are there lessons that you can share from that or challenges that we should all keep in mind when thinking about interoperability?
So the approach that we had for interoperability was to try to push the parts that have to change upwards out of the so you have this protocol that's defining how all these identifiers are generated and passed around, right? And once that's deployed to all these different phones, it's very difficult to upgrade. So our idea was to push the parts that are where the interoperability is most challenging, which are things like questions about what do reports consist of exactly, and who gets to authenticate reports, etc. To push those out of the kind of base protocol and into the application, so that the base protocol is really thought of as sort of a messaging layer between these different contact tracing applications, and they can get messages which are sort of exposure or risk reports, and different applications can make different decisions about what to do with those. So that also allows having like pretty different trust models. So one of the applications that was involved in the TCN effort from the beginning, before it was even called TCN, is COEPI, which is sort of like community epidemiology. And the trust model for that is explicitly people having opt-in just reports of symptoms of flu-like illness, not even necessarily coronavirus. But by pushing the sort of normative decisions about what does a report mean, who is allowed to send a report, and what does a report consist of, out of the kind of base messaging layer and into application considerations, means that even though those two applications have quite different trust models, they can still be interoperable.
Thanks. I want to go back to something that a couple of the panelists mentioned about authentication. There's a question from the audience about whether decentralized contact tracing systems would benefit from the use of validation mechanisms like a public key infrastructure to authenticate people. Henry, could I start with you?
It could be, but I think that PKIs are really hard to build and deploy. And so I think that it would be unwise to couple the protocol design to a specific PKI. If applications want to try to use some PKI to do attestation of reports, that is great, but I think that it would be a mistake to kind of hard code that at the protocol layer.
Carmela?
So from the DP3T point of view, this is even completely out of the question, because our goal is to notify at-risk people, and that has nothing to do with the identity of the infected people. So the idea of binding them to a private key is just like not even inside something that the system wants to do. So we're not even considering something similar to that.
Okay, thanks. So maybe one last question from the audience. Oh, Ron, did you have something to add?
Yeah, I wanted to say about also given about the PKI. So it also has to do with this centralized solution. First, I think that PKI doesn't necessarily mean that you identify who it is, that they identify people, the chirps or whatever, and who is infected and stuff. This is just a way to register to the system. It would require some level of registration, but you have a phone, right? So you can just type to the phone anyway. It doesn't need to be anything else on the phone. And the thing is that the PKI does give protection. That's one of the things actually we considered. We decided not to go there because of simplicity, but there are attacks that people can do against the protocol, that the PKI is the only way to prevent them. So for instance, one thing that this protocol would ever, any system, any automated system, even a centralized one, would never protect against is that, if I was in isolation for the entire 2 weeks and I only was next to Emily for 10 minutes, and then later I know that I was infected by somebody, then I know it's Emily, right? There's nothing to do about it. If some now taking that one step further, if I'm an attacker and I want to know who it is, I can make myself, the Sybil attack, make 1 million copies of me. Each one of them is going to be isolated for the entire time, except for 2 minutes. And then as soon as that copy gets infected, I know exactly who it was, right? The only way that we can think of to mitigate that attack is to have a PKI. And in some sense to attach, to limit the number of different copies of the system that you can have on your phone. And this requires some way of attaching the phone to have an identity for the phone. And of course, with using the appropriate cryptography, you can still maintain anonymity of chirps and location with all that, but that becomes a little bit more heavyweight. But that's that. And this also goes to a centralized solution. With appropriate cryptography, you can make a centralized solution, distributed, threshold, whatever, different parties, and could do lots of stuff. But this really becomes heavy. And we wanted this to be simple, understandable, easily deployable, etc.
Thanks. So I want to move on to one final question, and this is about the threat model, and this comes from the audience. I think that most of these systems have assumed a model of voluntary participation, and the question is whether you've considered in the threat model the possibility that this may become mandated and everyone will have to install something or not be allowed out, and how would that be handled? Stefano, I'll start with you.
Okay. So if I understand it, so in general, this is definitely not a problem. I mean, in the sense that if I understand the question correctly, right? So if we get everyone to use the app, that is not something that will affect the security of the system. It's actually going to improve the reliability to a big extent. I mean, other aspects that I think are important here to take into account and that we've been discussed at length is exactly what happens in terms of it's a bit orthogonal, I guess, to the question, but I think it's important and technically related. There are questions like spamming attacks, for example. So what happens if, what is the right model of validation for uploading positive reports to the server? But if I understand the question correctly, so increasing the user base is not something that does at least affect the protocol as we think about.
Okay. Does anyone have anything else to add? Henry?
It feels like there's a pretty big conceptual difference between, on the one hand, a system that is designed with the systems that we've been discussing, which are designed around doing contact notifications, and a system that would be useful for let's call it like proofs of health that someone could use to impose some kind of system of control, like not being allowed out. I think that those proofs of health systems are bad and fraught with peril and should not be developed. And so I feel some comfort in the sense that this system is not actually useful for building control mechanisms. And compared to other kind of, it's very difficult to know whether someone has an app on their phone or not. So I think that is a relatively less practical kind of law that someone could pass compared to, say, I don't know, other interventions. But I think in any case, the danger of some kind of absurd government overreach is not a problem that can be entirely solved by cryptography. So there's only so much you can do, right? You can't design a magic crypto protocol that will prevent a sort of a failure of like a social failure. All you can do is just design things that are not useful for building control systems.
Okay, thanks. So maybe we have a couple minutes left. One more question, especially for those who may not be familiar with all of the details of these protocols. The question is, what's the threat model at the system level, and what steps did you take to make sure that the cryptographic design or in the implementation of the cryptographic design that it doesn't reveal information that will de-anonymize people? Carmela, could I start with you?
Sure. I mean, at the crypto design level, like everyone else, we have published the protocol so that people can come up with attacks and discuss. At the implementation level, I mean, on the app itself, we're going through different audits. We have right now the app going through one multinational company expert on doing penetration testing. We also ask a couple of fellow researchers, experts on mobile security to take a look at it. And we're also taking a look at, from the traffic perspective, what traffic is leaving the app, to make sure that our developers have not missed any one of these libraries, that they're very used to just work with, because you use your own development toolkit and then maybe they forgot about something, and we want to make very sure that none of these things are going out. And we're doing the same thing on the backend side making sure that we can have as many audits as possible, because as far as I know, that's the only way we have to prevent bugs.
Okay, thank you. So, Ron, do you have one final thing?
Yeah, I just want to say that, so there are of course many technical things you can do, but maybe the best tool here is open source and public scrutiny. Because we know there are always attacks, and the best way to do it is to have it open, verifiable by everybody.
Okay, thank you, Ron. And thank you to the whole panel and to all the audience members for their questions. And with that, I will turn it back over to Danny Weitzner to summarize and discuss next steps.
Thanks so much, Emily. It occurs to me one of the big gaps in these webinars is there's no applause possible. So I hope everyone feels well applauded. Just logistically, I'll say that there'll be a recording of this webcast available soon. I think we have a little cleanup to do. We'll post it on the PACT website and let everyone know when that's available. I have just a couple of summary thoughts, and then I'm going to turn it back over to Ron Rivest. So where do we stand now? I think it really is inspiring that so many people have come together so rapidly in different ad hoc configurations to work to address this challenge. It seems to me, obviously, that has to continue. And now we have the question about how we can work together as groups of groups. That's sometimes a little bit more complicated than just people working together. But we're certainly really happy that everyone is here and are aware that there are a lot of other groups around the world that are working on this, and we're looking forward to being in touch with all of them as well. I think we've heard a little bit about what's needed here and maybe what's not needed. A single app for the whole world, probably not. A single protocol that binds across the sensing and the crypto layers, that might be a challenge, especially in these early design phases, as was observed on the previous panel. I think there are some kind of signposts towards cooperation and collaboration. There are a lot of engineering challenges we heard about at what we think of as layer one. Sounds like there's progress there, but still a lot to do. And if the problem has been solved, we haven't yet seen it in public. So it seems like there's quite a bit of work that we could do collaboratively there. I do think looking at the question of how we can work together at layer one and still maybe have different approaches at layer two is worth thinking through. From Luis Gutierrez and from JK and our public health panel, we heard that a real need for cross-platform convergence and interoperability, at least at a regional level. Obviously, having the largest sensor network possible is important, and I think having a clear path to widespread deployment, again, regionally, could be quite important. Though there's some skepticism, it sounds like, from the technical community on that. The Apple-Google effort is certainly related to this question. We know they've recently entered this space, and we look forward to having them participate in future events. I think other opportunities, priorities for collaboration include security analysis. This is a whole vulnerability analysis. This is a whole new design pattern, as was observed, where there are bound to be both expected and unexpected vulnerabilities, and working together to share experience there based on open source code and operational transparency is going to be important. Again, from our public health panel, we heard that automated contact tracing really has to integrate seamlessly into existing manual contact tracing efforts. It may be that in the US we're behind that broadly, just because we have a more distributed system and don't have a national healthcare system. So modularity, at least in the US, is going to be quite important. We've talked about both the technical and the social aspects of the privacy challenges here. And my observation is there's reasonably broad agreement at the principle level, but that there's a lot of work to do to really understand how those principles get implemented, what best practices are, and how to understand privacy at a broad social systems level, not just a technical protocol level. And again, I think sharing experience across the different implementation efforts and deployment efforts around the world is going to be really important for all of us to learn from each other there. So with that, I'd like to turn it back to Professor Ron Rivest to close the session.
Thank you, Danny. So I'd like to begin by thanking everybody involved in this conference. It's just been wonderful. I've learned a lot. Your remarks and comments are so insightful, and I look forward to continuing discussions and collaborations with each of you. Danny had a nice summary of what was covered in the conference, but you know, I think the work that was done by all of you to prepare those remarks was great. The work of everybody else who helped prepare making the webinar work and the question and answer format, and so a lot of people behind the scenes putting strong efforts on this. So just thank you to everybody for this. I think the big question is the one we ended up with at the end of the day: convergence, interoperability. How do we make our efforts synergize as well as possible? We're all looking for the same goals here, and to the extent we can learn from each other and then devise mechanisms that are interoperable or converged in mechanism, that would be great. As you all know, the effectiveness of these techniques may depend on sort of the fraction of how many people adopt them squared. So getting high degree of interoperability is important. And we may be able to do that at the level 1 layer, just passing random IDs around. So we need to focus on that. Next, we look forward to continuing this discussion with all of you. And so if you have suggestions as to what topics we should cover at a next meeting, or what, you know, whether we should have specialized conferences of some sort focusing on one of the other layers, and so on too, send us your comments and we'll try to structure something. This dialogue needs to continue at a fast pace. We're all moving quickly, but sharing information is helping us move more effectively together. So I encourage you to help us help you make it all happen quicker and better. So thank you all. Have a great day. Thanks for participating in this event, and hope to see you again soon. Stay healthy.